everyone. Welcome to another episode of Thoughts on Education. Today we have Dr. Surendra Lalwani from United Group of Institution with us. I welcome you, sir.
Thank you, madam.
So, I, Shubhangi Pant from College Dunia, will be starting with the interview. Before we go ahead, would you like to introduce yourself to our viewers?
Yes, madam. I got opportunity to introduce myself. Here, I'm Dr. Surendra Lalwani, and I'm completed my B Pharm, M Pharm, and PhD from Dr. Hari Singh, Gaur Central University, Sagar. And my specialization is the pharmaceutical chemistry. I worked on the cancer melanoma, that is the skin cancer. And last 20 years, I am associated with the academics along with the couple of years of the industry as well as the marketing. So right now, I'm in front of my colleagues and in front of you.
Nice.
Thank you for calling me and providing the opportunity to interact with the students also.
Thank you so much, sir.
I work in a Bhopal. Yes, madam. Thank you. I worked in a Bhopal in a marketing, and I started my career as from the academics.
Okay.
And after that, I have shifted to the Gwalior, and right now I am working last 4 years in the Greater Noida region. So I got experience, well exposure of the marketing industry as well as the academics.
Nice.
So as per my academic part of view, I am associated since long with the students, and so many students are interacting with me right now also.
So since you were just saying about yourself, you have been through a different places nowadays, and from the past 20 years, you have been in academics as well. So what are some of the key factors that keep you connected to the education sector?
Yes, madam. Basically, right now, practically what we have learned and we are providing to the students. Actually, since if I join the academics directly, so I cannot give the better exposure to the students. What are the key factors in the marketing? What are the key factors in the industry? And what are the key factors for the future further studies?
Exactly.
So we can better guide and better help to the students. I'm also having my better hands with me. That is my faculty members. So we are having the very talented faculty members, and I'm associated with the faculty because I cannot work alone. I have the teamwork. So they are also having the good exposure from the various academics as well as the different field like pharmacovigilance, marketing, industrial experience. So we are giving our main target or motto is to provide the betterment for the students because they are connected not only for the 4 years or the 6 years, but up to the long lasting they are connected because they are attracted emotionally, or we can say the physically they are with us for the 4 years and 6 years. Up to the B Pharm, that is the 2 years, and for the M Pharm is the 2 years, and for the B Pharm 2 and diploma for the 2 years. So we are having the good exposure and where they are placed. So we are having the also opportunity to interact with our new students also. That is the alumni, we can say कि हम जहाँ जुड़े हुए हैं तो और एक चेन हमारी बढ़ती जाती है. तो ये हमारा कारवां बढ़ता जाता है, मंजिल तो सबकी एक ही है मैडम.
Nice. Sir, as you were talking about teamwork also, my next question would be regarding that. So what is your philosophy of leadership? How would you like to describe your leadership style?
Madam, leadership actually starts from the captain. So as per my opinion, if I am having the positive views, I can disperse to my other team members because I am the follower, they are the followers. So what is my decision? Not only my decision, because decision comes from their sides only. So that is the actually compilation of their decision and my decision. So we are taking one decision, what will be the beneficial for that. So they used to follow that without any interest. Because I especially instruct them to follow that. So that is not feasible for them also because they are not happy as well as they are not convincing for that particular decision because that is a mind decision only. But while we are taking the decision from our team members, so that they obey and they follow that because their decision, they are practically learning the things, they are directly connected to the students also. As per my part, I am also connected with. But rather than while they are connected very closely, so a student having some distance with me.
Huh.
So they know better and they gives the clues ki this is the beneficial for the students and used to we are the follow. That is the plain leadership.
Nice.
Ki decision is theirs and they are the also followers.
Followers.
They just are the leading parts. Yes, madam.
Okay. So, sir, since you're taking care of the pharmacy in your department, basically, so how does the curriculum of your institute ensure the best practice of industry?
Yes, madam. Because education is providing by the all colleges. What are the syllabus, curriculum part, they all use. But how different we are from the other colleges.
Exactly.
Okay, that how we are different from the crowd. So as per that also depend our the team members and the student part of views. We are giving the additionally. Because most of the student right now, first while they are getting admission in the college, first question is that, are you having any placement? So a student has to wait for the 2 years and 4 years. After that, if he or she is not getting the placement, so that they demoralize. Ki how enthusiastic I was, so that right now I am not able to stand any market or any industry because college do not any help. So we are having our excellent department, that is the mass communication department as well as the MBA. So they are very cooperative and they are our right hands also.
Nice.
They help especially for the various pharmaceutical industries, marketing as well as for the associated organizations. So a student used to attract on that. They are having some sort of department like MBA, BA, JMC, engineering. So somewhere and already that is the running institutes. So students are faith on college. That is already in the running condition. Right now we can get the better placement. And also right now we are conducting various webinars, seminars, and that's a good luck that we are getting the resources available by the Greater Noida also. In this year also we got the very good exposure in the Expo Mall. That was a pharmaceutical big Asia's large exhibition. So we are having the good exposure because we cannot move at this time of the infection. Students are not allowed in the industry. So they got the very good exposure, especially with the Greater Noida, that is nearly half a kilometer from our institute. So students were very happy that on their spot or on their college, they are getting the opportunity to visit the latest equipment, analytical equipment, as well as the industrial equipments at the same platform. So we are that different, especially for the hospital visits or hospital training. We are having tie-up with the various hospitals. So they are giving the training in industrial. Also, we got the good exposure, especially right now we are applied for the industrial tour. So virtually we are got the permission, but I'm interested to go for the physically to industry. We are approaching for that, and definitely soon we will get the opportunity so that our student can visit the industries also, pharmaceutical industries.
Nice. And
we are having the
yes,
madam.
Some of the most important function in the role that you play in your institute.
Yes, madam. Important function right now, like conduction of the various sports and activities, webinars, and after that we are planning soon that the guest faculties, they come to our college and they deliver the lecture. Earlier we have done also this, but before that couple of this months, before few months, we are unable to that. But virtually we are giving the various resources to the students also, so that they can learn. And we cannot say that it is the negative point of the corona infection, because students are very keen to learn. They are various, I can say that they are very close to the latest technology. पहले कोई जानता नहीं था what the Zoom, what the Google app, and right now they are very used to all these things. So that is, we can say, the plus point for that also. The students are learning and we are keen to interested to learn the various things through the Google Meet and what the various platforms available.
Nice. And so how is your relationship with the students of your college?
So nice, madam. So they are very happy. You can take the feedback also from the student. I can connect to the students. So
That is
practically, actually, we used to emphasize the student on the practically things.
practical.
In the laboratory that we are having the laboratories and what the theory students are learning, most of the parts we are conducting through the practicals, and so many important things they are learning. What they cannot teach by the books, what they cannot learn by the books, practically they are facing that situations and they are learning on that things. So that is a very key factor for the students. They are learning in the practical lab, because pharmacy is totally dependent on the practicals.
Practical. And
So not
pharmacy
like
has
the
also
other-
seen a surge in the COVID department. We have seen that how pharmacy has been affected, and it's playing a big role when it comes to the education sector as well, and also in the pandemic, because everything was
madam.
revolving.
They play a very big challenging role. Nursing and pharmacist.
Pharmacy.
So they were easy, yes, madam. Say they were the corona warriors. They gave the big role, especially for that during this infection. And government also allowed the pharmacists to go to the hospitals and care the patients.
Yeah.
Because, madam, they learn, especially while they are taking the admission in the pharmacy, their first any medical help they need patient, that is their duty. Their pharmaceutical ethics are there. So one norms is there. Any pandemic situation, you cannot stay at your home, but you can give your better facilities to the patients and near surrounding any hazards or any environmental hazards or any effect or the health injuries to the patient. That is your duty to save the patients. So that they are learning, and they are very continuous by honestly they are working that.
True.
So they are also learning in the hospitals, industry, and what they are facing they are very close to that. हम अपनी सेवाएं वहां दे पा to serve to the patients. That is good.
And so, any message that you would like to the current youth?
Current youth, madam, there is the health sector is the only sector that is the endless jobs. है ना, ऐसा एक सेक्टर है जहां पर जॉब की कोई कमी नहीं है, because the deficiency may be to the particular, but not in the pharmaceutical industry, academics, and there is no end, especially for the academics. D Pharm, B Pharm, M Pharm, PhD, postdoc, so many opportunities are there. So student should not demotivate or should not demoralize if we are not having any opportunity while we are taking the admission in pharmacy.
True.
There are a number of jobs are available in any sector. If you are going for the academic, if you are going for the rural pharmacist, railway pharmacist, drug inspector, food inspectors, and medical line, hospitals, pathology, everywhere the lumps of the opportunities are there. And now that is the again spreading the various infections, and what the government has started the various in rural areas, dispensary, hospitals. One key role factor is of the pharmacist. And also medical store, one pharmacist should be there. Is it compulsory? So we cannot say that the endless jobs are there. There are so many jobs, opportunities are there. Youth should not demotivate or demoralize कि हमने pharmacy में admission लिया, हमें job की problem है. No, nobody is unemployed in a pharmacy. Everybody is employed, and they are having giving their services everywhere in the every segment. My message is to youth: not need to worry that there are so many opportunities. Work hard in the right direction, and they will get the various opportunities. There always doors are open for the opportunities.
Wow, sir. That was a very amazing answer, I think. So the interaction, I think, so far has been amazing, and I would like to end over here only the interview part. And in case we want to go ahead with second part, we can have another round. But for now, I think we are almost done.
Sure,
so,
madam.
Thank you, sir. It was amazing knowing about you. We have got a lot of insights from you.
Yes, madam. Most welcome. You are most welcome.